Welcome to the Doctors Making a Difference podcast, where we help physicians to be empowered with the tools they need to be successful in medicine, in finance, and in life. Join us as we highlight doctors and other professionals around the world who are making a difference. You've spent years making careful decisions with lasting impact. When it comes to investing, the same principle applies. Lightstone Direct gives you access to institutional quality real estate investments with decades of proven experience behind them. Invest directly, no middleman, and a $12 billion plus AUM real estate firm in your corner. Visit lightstonedirect.com. All investments involve risk. Please visit lightstonedirect.com for a full list of disclosures. I am pleased to welcome Dr. Robert Beck. Rob is an interesting guy. He has been an internist, worked in the United States for a number of years, and has recently made the transition to practice in Canada. Also, he decided to start a podcast and a YouTube channel called Interesting MD, which is fascinating. I encourage you to tune in. Rob's fascinating to talk to, and I'm excited for this conversation today. Rob, do you mind introducing yourself to our audience?
Not at all, Peter. Thanks so much for having me on. This is very exciting. We met interviewing you on my podcast, and it's a huge honor to be invited on here. So, like you said, I'm Rob Beck. I'm an internist. I grew up in Tennessee and went to school at the University of Tennessee, worked as an environmental consultant. I swore that I would never go back to school when I crossed the stage, and worked as an endangered species bat biologist.
A bat biologist?
Yes, indeed.
No
Yeah.
way.
You hear all the Batman jokes, of course. Back in the day, I worked for a guy that I didn't really like. It was like The Office, but it wasn't funny. So I was just kind of like, all right, I need to do something different with my life.
All the personality disorders without the humor.
Exactly. All the malignancy without the comedy. Then went back and got my master's in public health at Tulane University and thought I was going to go and live in Africa and work for an NGO. And while I was there, I met a bunch of guys on the med school rugby team and started playing rugby with them and thought, you know what? I think I do want to go to med school. It had kind of always been a goal of mine, but I thought it was never going to happen. So I got to go to med school, got married to my wife, who is also an internist. We met getting our master's in public health, then stayed in New Orleans for a total of 10 years, had 3 kids, and decided that it was probably time for us to move. And we moved to Nashville, Tennessee, where we worked in a traditional internal medicine practice with amazing partners. And we were there for about 9.5 years or so during COVID. And I'm sure that we'll talk about this later, but during COVID, we just kind of made a change. And my wife is Canadian. We decided to move to Canada. So now we work as internists here on Vancouver Island. That's where we are with my wife and 3 kids. And we're here working as an internist.
Most people listening to this are doctors. And I think everybody can relate to the idea, okay, I went to school for a long time. I went to residency. I got my first job and, life kind of happened. I took one job and then after a decade switched to another. Lots of people do that. But then there's this like, hold on, stop for a minute. Rob just said he decided to leave the country and totally change gears. You had the connection with your wife being Canadian, but that's still a big shift to say you're trained in the US medical system. You've worked in the US medical system for the better part of 2 decades. You understand the system inside and out. I want to hear the transition. It takes courage to not just leave medicine, but to say, I still want to be a doctor. I still want to do this, but I'm going to go to another country and stay there.
I'm going to get to your answer, but the fact of the matter is, we just like to do things very difficult in the most difficult way possible, I think, with the most effort. We had our first kid in 3rd year of med school, our second in the 2nd month of our residency, and our third just before we graduated from residency. So we like to do things as difficult as possible. So my wife, when she moved down, never thought that she was going to move back to Canada. This was, early 2000s, 2001 when she moved down, never thought that she was going to move back. We were very happily practicing. And throughout this whole process of the podcast and talking more about it and having some time to reflect, it wasn't anything that my job did. It wasn't anything that my partners did. I have amazing partners. I've even interviewed a few of them on my podcast that I love those guys. I love the people that I worked with. I love the clinic managers, but I was just really getting burned out and I didn't recognize it. And I just needed to do something different. And one of the things that really pushed me over the edge, I mean, I was totally flaming out, burnout. I recognize that now, but I was just flaming out. And I was just looking to make a change, any change whatsoever. And when COVID hit, things really changed. Like the thing that makes me happy, I'm not one of the people who has, said, "Oh, I want to be a doctor" when you're 17, 18 years old, and then you get into it and you're in your mid 30s, mid 40s, that, you realize maybe this wasn't the right decision for me, which is a perfectly fine and valid decision. Like that's great. And I think that more people need to be honest about that. But I realized that I was only ever happy when I was sitting down talking to the patient. And the second that I walked out the door and walked down the hallway to my nurse's station to finish everything, I was unhappy. And I was unhappy walking back to the room. And I was unhappy anytime in medicine. I wasn't unhappy with my wife or my family or anything like that, but I was unhappy anytime that I was not in front of a patient. And I realized that just needed to change. And when COVID hit, a lot of that went away, to be honest, because half of my patients started accusing me of really terrible things, insurance fraud, just really, really bad things. And it was frustrating and hurtful to me because my wife and I are both epidemiologists. We have our master's in public health and epidemiology. So finally, everybody knew what an epidemiologist was. And I was very proud of that fact. And yet, I still got accused of really, really terrible things by my patients.
Related to COVID, like
Yeah,
accusations related
related to
to
COVID and accusations and really argumentative and yelling and things like that. And I'm fine with people not understanding and not knowing because it was really complicated and it was a really difficult time and a very scary time. But having people that I had held their hand when their husband died, and I was literally in the room holding their hand as their husband died, and they come in and they start accusing me of really, really terrible things that obviously were untrue. And that really took the wind out of my sails. And I just needed something different. And I didn't put all this together at the time. I just knew that we just needed something to change. And so my sister-in-law is an internist in North Vancouver. And she said, "Hey, you guys, if you want to make a change, you should come out here." And long story short, we were able to come out here, but not until we moved. And so we just decided to get a job. And once we did that, we moved our family out here in December 2020 and have been working as an internist since.
it's kind of a crazy story. Like I said, lots of people can relate to the idea that I'm burned out during COVID. Again, lots of people you get falsely accused. First, the doctors are the heroes that are out facing bravely this virus that's out to get us, and then you're part of the machine and all the things that people looked at. And it really was just an epidemiologic situation, and we needed information. I think it was really stressful for the public to watch science happen in real time when you don't have answers. We don't have all this controlled data that we are used to getting when we roll it out to patients. It was just in real time. We have to deal with the crisis as it was.
It's an ugly process, right?
It's ugly and there's lots of fits and starts, and I don't think it was handled the best in every situation because when people would say, "Hey, we know this," and in fact, we say, "We suspect this. The theory is this." We don't know until we actually get statistical models that actually predict that this is actually the case. And anyway, you got caught right up in the middle of that as an internist and an epidemiologist, and sounds like it was just sort of the straw that broke the camel's back, to so to speak.
It really was. I mean, it kind of pushed me over the edge. And looking at it now, I mean, I'm not thankful that we went through COVID or anything like that, but I'm thankful that something so drastic happened that it forced me to make a change. And again, that move was very difficult. That was all during COVID, so we bought our house here online on FaceTime. So my mother-in-law and father-in-law, they live in Toronto, and so they were kind enough to fly out here because they didn't have to quarantine. They went around and looked at the neighborhoods and looked at the houses, and we looked at everything on FaceTime and bought our house on FaceTime. I had never been to British Columbia until we drove across the border. Never set foot. That was just kind of, again, one of those things where it was just a leap of faith and just, okay, we'll make it work. And it was interesting times, and it was really tough leading up to it just because of trying to wind down my practice or, transition my practice over to somebody else and to just move internationally during COVID. That was really interesting.
Very challenging.
Yeah, and it was not as easy to get a license here as it is now to when we first started, so there was a lot of stress surrounding all of that, but we're here.
Oh, that's awesome. Now that you're, 5 years into it, I wanna hear your experience because I'm sure there's somebody listening who says, "Well, I've gotta figure out something to change. Either I've gotta change a job or I've gotta change the way my job is," or maybe they're like you, "I can't exist in the existing system that I'm in, and I need to change to be still a physician, but I gotta work somewhere else." And I'm curious, what has been the reality of that change for you?
So, yes, if there's somebody out there who's looking to drop a grenade into the stability of their life, I am the person to talk to. So, it has been great. It was a stressful start. I definitely will not lie about that. It was a stressful start trying to get our license and everything during COVID. We moved up here the week before vaccines started rolling out in the US, and it was really stressful, but it has been great. It was a little bit of a shock into the healthcare system. Like, I worked at an extraordinarily nice hospital that everything would just go really fast. And, hospitals don't compete here. They're all paid for by the same person. You don't have multiple hospital systems trying to compete. And so the facilities aren't always as nice. Sometimes they're really nice, but the facilities are not always as nice. And that was a little bit of an adjustment, but it's not really that big of a deal. Patients are patients, right? My colleagues have all been wonderful. Everywhere that I've gone, they're all amazingly trained. They're wonderful doctors and just truly wonderful people. And the patients are absolutely amazing. And it was a very different attitude here that there has been such a doctor shortage here that everybody was just thankful that I came up and they were like, "Oh my gosh, you must be American because of your accent." Just the ways that I say things, I refuse to transition over to process or Z. It's process and Z, and that's it. I am bilingual with Celsius and Fahrenheit. I speak mostly in kilometers these days to most people here, but haven't forgotten about you, Miles. But the patients have been really amazing. And there's certainly different things about the system that if you wanna talk about, I'm more than happy to.
Well, I'm just thinking like when I've traveled outside the US and seen hospitals, it seems like you're missing the high trim features or the lipstick features on, facilities. And sometimes, you don't have this super high trim level where everything is kind of made up to the fanciest level and you feel like you're entering a grand hotel. It's a little bit more Spartan, a little bit more utilitarian. But on the other hand, probably some of those healthcare dollars aren't necessarily spent on trim features and are a little bit more dedicated toward patient care. I guess the biggest going theory or the thought that people kind of circulate in public vernacular is that things take a lot longer in Canada than they do in the US. And my curiosity is, have you found that to be true when somebody has something that's semi urgent? Do you find that patients can get the care they need in a timely fashion?
So for urgent things, it's all pretty much the same. And I will only speak to Vancouver Island because that's the only place that I've practiced. And I know that there are some things like my in-laws live in Toronto, kind of in the northern Toronto area, and they have lots of new hospitals there, and things happen faster over there than they do here on Vancouver Island. I'm not sure about in Vancouver itself. And I have seen the less urgent things take a very long time. They can take a very long time. But if somebody has a heart attack, if somebody has a stroke, if somebody needs an emergent surgery, you get all of that stuff by very, very highly accomplished and competent doctors, like highly competent doctors. And I've seen no death panels. I have seen no death squads. I don't see people dying waiting for something that is truly something that would change that outcome.
That's good to know, actually. I mean, because you see the people in Canada vote for leaders, and the leaders, help set up these systems, and you still want your family, your loved ones others to receive care, but you don't want everybody to have, everything done at this super duper urgent speed if it's not something that's urgent. And I guess the trade-off is that everybody has health insurance. Walk us through that because that's got to be quite a different thing where you don't talk about, well, what's your insurance, what's your coverage, what's your copay, and how far are you away from resetting your deductible? Because I feel like I have those conversations many times every day.
Yeah, and now this is like deductible season now, right? You're entering the 4th quarter, and so now you've gotta start getting people their hip replacements and all of the other surgeries, all the other elective surgeries that they've been putting off. So we don't have that here. I will tell you that the biggest thing that I have noticed about practicing is that it really is just me and the patients, and there are definitely times where the EMR frustrates you, but I mean, we have the same EMR that we use Cerner Power Chart at our hospital system, like in Vancouver Island. But there are other places that use Epic, and there are places that use Meditech, and the outpatient EMRs are the same thing. The documentation requirements are a lot less here, but that part is neither here nor there for me. There are a lot of people that are using AI scribes now. But just like you talked about, it is amazing to be able to just sit down, talk to the patient, figure out what they need, and then they can get it, they do it. There's still some prescription coverage things, every once in a while that not all the meds are completely covered, but patients can get what they need. That's really kind of the only prior approval or stepwise thing that you have. But if my patient needs a CT scan, they need an MRI, they need an ultrasound, they need to be admitted, they need a surgery, nothing like that. There's nobody to call, there's nobody to reject that. They don't do it. Same with all the labs. And for me, billing is the best. That is the best part. I do not need a billing, I need my phone. And I have an app. I put in the patient's information. Now I just put in their health number, although people have told me, and I just never do this, but you can just take a picture of the patient's name, their date of birth, and their health number, and it will actually enter in everything automatically. And I put in my charge, and I put in the diagnoses and the data service, and I hit send, and I just hit save, and it uploads. And somewhere between 15 and 30 days later, I get paid for it. There's no billing department, there's no collections department, there's none of that overhead. There's nobody who has to keep fighting to get all of this. I'll have maybe 1% of my charges where they send it back and say, "Hey, what's going on here?" Sometimes I put in the wrong date or I duplicate a bill or something like that. But it is that easy that I go through, I see a patient, I write my note, and then I do my bill, and then that's it. That's the last I hear of it, and then it just gets automatically deposited into my account in, again, 15 to 30 days on average.
Are you an employee of the state or of a hospital, or are you an independent contractor? How does that work?
Independent contractor. Yeah, so I get privileged by the health authority. So I guess the province gives me a license, right? So I have a license through the province, just like you have a license in Idaho. You get a license by the province and then you sign a contract and you get privileges at the hospital, just like any other hospital privilege that you get in the US. And then I sign on with different groups. I've signed on with different groups about, yes, I'm going to work here in this capacity, but my pay does not go through the groups. It does not come through that mine is my fee for service work all just goes straight to my bank account. So as an independent contractor, so kind of like a 1099. I am in the process of incorporating right now to kind of incorporate as a small business owner. I'm functioning as a sole proprietor right now.
So think about that. In my mind, if you go to work for a national health service, you are employed by the national health service. And, I think that's kind of what's represented is like, well, you'd be an employee for this big machine, but you're able to start your own business, do your own billing. You have to be accountable for that billing and make sure that you have documentation to support it, et cetera, just like you would in the US. And then you mentioned offline that as an internist, the Canadian system treats you as a specialist. And I'm interested to how does that work?
Yeah, so that was a little bit different. It's not terribly different. You kind of do most of the same stuff, but here The only people that you can go to kind of unreferred are family medicine doctors. We don't call them GPs anymore. People still say that. I don't like that. But the family medicine doctors, if you need to see anybody else, you have to get a referral from your family medicine doctor or an ER doctor. They would go through when somebody comes into the hospital that they get admitted to the hospitalist, which are predominantly, although it's changing a little bit, predominantly family medicine doctors who are working in the hospital. And then they consult us and we see those patients. And you act either in a consulting capacity. Some internist groups, the internist will admit kind of the telemetry patients. So uncomplicated heart attacks, really, really complex sepsis that's not quite ready to go to the ICU or doesn't quite need to go to the ICU, DKA patients that are a little bit more involved and complex and multi system issues. But for the most part, in a lot of the places that the hospitalist will admit, and then the internist will just kind of come in and consult on what it is that they're there to do and then step away. Same thing in the clinic. So the family medicine doctors do an amazing job of taking care of patients. And when something gets a little bit more out of control or that there's something that they need a little more help with, whether it's really refractory hypertension or uncontrolled diabetes or endocrine problems or whatever else, that they will refer them on to the internist for some help with that. Also with stress test, I never did any stress tests. I know some of the people in my clinic used to do treadmills, but rarely. We do some treadmill stress test here. That was a little bit different.
Yeah, it keeps you busy all the time. It's just interesting how it's designed to be kind of a gatekeeper through the ER or some of the primary care physician workforce. And in the United States, most of our people that would kind of be in the specialist column would be internists who've gone on and done a fellowship in cardiology, nephrology, endocrinology, et cetera. But as a general internist, you kind of fit into that same mold in the Canadian system, which is really interesting.
Yeah, so pediatrician, gynecologist, internist, those are all considered specialists here. And so you can't really refer yourself directly to one of those. So you would have to get a referral to come in and see us.
Well, so another question is you mentioned in 2020 when you went there, the regulatory environment, I mean, it was challenging because of COVID. Everything was on pause. You couldn't go across international borders unless you had lots of documentation. You couldn't go back and forth free will like you generally can. I want to know from the physician licensing standpoint. I know you mentioned on your podcast that that has changed and become a little bit more of an open arms, welcoming doctors to come in, at least in Vancouver. And I'm curious how that part, because that sounds like a big headache from if you say, I'm going to go to another country and try to be licensed in that country. That's a major undertaking for paperwork. Curious how it was then and versus how it is now.
Yeah, for us then, that was tough and it was very bureaucratic. And we actually were fortunate because we did a fourth year of internal medicine as chiefs. So both of us did that. And because more than 50% of that was clinical, where we were attendings and we were doing a lot of teaching and administrative stuff, but we were attendings on the ward and attendings in the clinic several times a week. So we actually qualified to sit for the Royal College exam, and that was actually the first step that we had to have was an approval from the Royal College, which is kind of like the overarching everybody licensing board nationally. And we got approval from them to sit for the Royal College boards. So what we had to do was actually study for and take the Royal College exam for internal medicine, which they only give it once a year. It's a two-part, so there's the written exam and then there's an oral exam. We didn't take it the first year that we moved here because it was too late to sign up, so it was just a huge pain. So we finally made it through that though. So now we are board certified with the Royal College of Physicians and Surgeons, and that we're certified internists, we're fellows of internal medicine. That's neither here nor there. But now you do not have to do that. That is for most of the provinces now. So British Columbia, Ontario, all of the Atlantic provinces, and I'm not going to name them off. There's four, but I've never been over there. And so I'll probably screw it up, but the 4 Atlantic provinces that are kind of banding together to attract more US physicians who are just looking for a change. And I feel like some of the other provinces are doing that too, but I'm not as familiar with their processes right now, but I'll learn. And they have made it very easy where I know for sure for Ontario and for British Columbia, and I'm pretty sure for the Atlantic provinces as well, that if you are board certified in the US, you can come in. You get a license, you can work, and you are unrestricted. So when we first came in, we had to have supervisors. So you had to have somebody be your supervisor that you would check in with every few months and that they would have to like send in a report to the BC college. So it was kind of a pain. It wasn't overly onerous, and that my wife and I were fortunate to have amazing people who were willing to supervise us. I mean, it was not like an interrogation or an inquisition or anything like that. They just were there to help you kind of make the change, which was fine. But it was a pain. But now you don't have to do any of that. There is nothing like that for sure in those provinces that I were talking about. So if you are board certified in surgery, welcome. You get to be a surgeon. If you're certified in family practice and gynecology, neurosurgery, you can come in. You can get a license. It is unrestricted. You are free to go.
That is a huge change. You just think about the amount of time you and your wife spent dancing through those regulatory hoops and the money. And so it's a big change. And I'm assuming, like you pointed out, the Canadian provinces that need physicians are trying to do this so that they can attract the talent from the United States. Are they looking at other countries, some of our European counterparts as well, or is it primarily targeted to US based physicians?
Yeah. For the moment, I think that they are making it easier. I know that there are some people coming over from the UK, especially in British Columbia and Vancouver Island. Like we get all the people from the Commonwealth countries. I mean, my gosh, there's tons of Australian doctors here, lots of South African doctors here, lots of people who have come over from the UK, lots and lots of people here like that. And that's just on Vancouver Island and some of the people in Vancouver that I know. But they are definitely bringing those people in, but they're really targeting US trained physicians right now. Number one, I think culturally it's very, very similar. They have data now that has shown that anybody who's trained and board certified in the US, they have a long history of data that shows that they integrate easily and that they're all very competent and they don't have any problems with it. So I do know that there are some people from the UK who have moved here recently, and I'm hoping to talk with a couple of them, but they're really focusing and making this about US doctors as well.
We started off talking about your process of working hard and, like I say, for almost 20 years in the US system and becoming to the point where burnout became a real thing. It wasn't just this theoretical issue. You felt it was hard. And so now, 5 years into this, you've made this change. You appear to be pretty happy with the change. And I'm curious if that's true. And then also, what are the substantive or measurable things that you would say actually made that biggest difference other than just a change?
So, to be very clear, and I'd never admitted this before, except for when I was talking with somebody, I'd never mentioned this, but when COVID first hit, kind of late 2019, early 2020, they were sending out physician wellness surveys. And this was even started a little bit before when COVID happened, like again, November, December 2019. I remember getting these emails and I answered these questions, and I had a 31% chance of suicide is what they told me based off of that. I didn't feel that way, but I was like, "My god, there's something that they're seeing in the ways that I answered these questions." I wasn't just like 0 out of 10, 0 out of 10, 0 out of 10, just like angrily. I was like, "That's an anonymous survey, so I'm just gonna answer it honestly." That was really shocking to me, and I was always angry. My kids talked about, the big joke with my kids was when something would come up, I would just do this and I would just grab my eyes and the kids would start laughing then because they would be like, "Oh, here it goes." I was just uptight. And I'm not like that anymore. Do I get frustrated sometimes and tired? Yeah, yeah, I definitely do. And there are things that weigh on me, but there's a bigger focus on work life balance here. There is not the administrative burden. Like, people here still get pissed off about the EMRs and all of that, and fine, like, I totally get it, but people here have no idea about prior authorizations and denials, all of these other things. Like, I mean, there's other things that are frustrating, like, sometimes having to fight a little bit harder to get somebody a test that they need or, to get them seen and whatever. It's not perfect. I will tell you that. But my change just in my ease, my attitude, I am much different and I am much, much happier. I'm fortunate enough to where we live 2 blocks from the beach. I walk out my house right here and 2 blocks, I mean, when I get to the end of my street, I can see the beach. I can see the ocean. And it's a cold ocean, but I can see it. And I love being able to walk down, and that is just something that relaxes me. That's something that makes me happy. It is something that at the end of a tough day, I go down and I just look at the beach. I look for seals. I look at ships that are going by. I mean, these huge international ships will go by on their way to Vancouver. The cruise ships from all over the place come down. And I mean, we bike, we run, we exercise, we do things that make us happy. And I don't know how to say it other than just it has been a change that we are happier. Life is not always perfect. I get that.
But you rediscovered the joy.
Yeah.
You found a way to practice medicine, still do these things where you're helping patients, but you don't describe dread walking down the hallway from a patient room and anger with just very little provocation when you come home. And I think everybody goes through different chapters of life where you're pushed really hard. But if that's going to be your normal for all the rest of your life to just be at that level of intensity and frustration, no wonder people get to where they're burned out, and no wonder we have a high suicide rate. So, boy, if you're listening to this and you're someone that finds yourself like what Rob experienced, the alarm bells should go off. It's time to make a change.
Listen to that.
Doesn't mean you have to leave medicine and never be a doctor. It means, hey, I got to get some help. I got to get some coaching. I got to change something about the practice situation. I've got to cut back the hours. There aren't very many doctors who work, a lot fewer hours that experience that level of frustration. It's when you just have no control, no time, no ability to really self-regulate. And then you get to where you're just stressed all the time. And you found a way to change that, Rob. It's really impressive, actually.
Well, it was not easy. It was not just like a walk in the park, but we really, and I credit my wife with this as well. I'd love to take all the credit for this, but I used her Canadian citizenship to get into the country. But it was just the two of us looking at each other and thinking, we just need to do something different. We just need something different. And the something different, it was really, really different, but it worked. I tell people all the time the grass is not always greener, but there's grass. Doing what we were doing at that time and continuing on with that would have been catastrophic for us. Not our marriage or anything like that, but physically, emotionally, there was all this stress of student loans, and we were still paying off our student loans at that time. I'm still paying off some of my student loans, which really frustrates me a lot. Thinking about, my God, we're still paying off our student loans, and we have kids that are headed off to university in a couple of years. How are we going to afford to send them? We make too much money to get any financial aid, but we don't make enough to be able to pay outright for our kids to, $100,000 a year. I fortunately don't have that stress now. Canadian universities are exceedingly like a fraction of the cost of the US universities. That has been something that has been a huge relief. You don't have to have a 529 that you dump half of your annual income into, hoping that it'll be worth $500,000 by the time your first child gets to university. That's not necessary here.
Rob, thank you for sharing. You speak from the heart, and I can tell you, like, that stuff means a lot to you, and it's awesome. I know you host a podcast called Interesting MD, but I think you're one of them. I mean, Interesting MD, Robert Beck. I mean, it's been fascinating to hear your story because, like I said, not only did you experience kind of what all the doctors eventually experience in the United States, or at least a lot of them, you made these substantial changes. And now, in hindsight, you can say there's hard days, just like there always are, but I found a way. I can tell you speak about the future with hope and brightness rather than frustration and burnout and anger. So it's a good example. And I hope that others listening can take some inspiration from that.
I really appreciate that. And that's very kind of you. When I first started the podcast, I kind of wanted it to be like physician hobbies and just like Hey, encouraging physicians to like step out and just start doing something on the side that makes you happy, and doing triathlons or scuba diving or learning to fly or whatever else. And I've done all those podcasts, and I think that that's really great. But what I've learned is that doctors sometimes just need to get out of the rut and just try something new, something different. And we all have something that is very interesting about ourselves. And that's why I called it the interesting MD. Not that I was the interesting MD, but it was just that every single one of us has something interesting about ourselves. And if you want to try something new, you want to change something, you want to do something different, it's actually not as hard and it's not as scary as what you think. It is really easy to just kind of have a, all right, I'm just going to try it. If it's a new hobby that's something that you think would be really cool, that's what I wanted to encourage people to do. And it just turns out that I've kind of struck a chord and have met the moment, I guess, of people thinking, you know what, maybe I just want to completely change. And I just want to move internationally. And is that possible? Yeah, sure, it is. It's not as scary as you think.
Well, and I think people make these self-imposed boundaries and rules. They're just self-imposed. I mean, you need to be a decent, honest person and take care of your family, be a good employee and honest in your dealings, all that kind of stuff. But really, everything else is your choice. You may make the choice you want. And I just think it's inspirational, Robin. I appreciate you sharing it. I actually encourage anybody listening, go check out Interesting MD on podcasts or YouTube. They're fascinating. I've been able to listen to a couple of them, Rob, and I think it's great. I appreciate what you're doing. And I think it actually makes a big difference for the physician community to hear and highlight these different stories of doctors doing all this stuff. Appreciate what you're doing. Thank you.
Well, thank you so much. I really appreciate it. And just very quickly, and we can cut this out later if you want, but one of my old rugby friends from medical school, David Guidry, reached out to me and he was like, "Holy cow, you know Peter Crane?" And he's an ICU doc. We actually played rugby together, and Hurricane Katrina has kind of separated us, and we hadn't seen each other in 20 years. And he saw, me on LinkedIn, and then he saw the podcast and with us, and he was like, "Oh my gosh," and just reached out, and just really serendipitous. So I thought that was just really, really kind of cool.
Well, it is fun because the podcast can connect all sorts of people, and there's really so much about physicians that is really similar, and it's really fascinating to talk to people because everybody kind of has this similar bandwidth, same level of like extreme nerd, but also really interested in all these other parts of the human existence. And I applaud what you're doing, Rob. I look forward to staying in touch and following your work. Again, encourage others who are listening to do the same. So again, thanks again, Rob. Keep in touch.
Thanks for everything that you're doing, and thanks for giving me the opportunity.
Thanks for tuning into the Doctors Making a Difference podcast. And thank you for what you do to help your patients and your community. Your work truly helps so many people. We produce this content to help you have the tools you need to stay in medicine and to highlight the amazing work being done by physicians around the world. Please note that while I am a physician, and many of the guests on this program are also physicians or other professionals, the discussions on this podcast do not represent my employer or any professional organizations to which I belong. This podcast is for your information and entertainment only, and should not be taken as professional advice. You should seek appropriate professional advice pertaining to your own situation. Please check out more of our content on our website, doctorsmakingadifference.com. Also, please follow, like, or subscribe on your podcast player or YouTube channel, and give us a 5-star rating. It really helps to spread the message. Finally, if you'd like to be a guest on the podcast, or if you'd like to nominate someone else to be a guest, please visit the website or email admin@doctorsmakingadifference.com. See you next time.